Okay, we ready?
So just to confirm the route for you.
Yep.
We'll start here. You'll have this in the background. Then we'll go in front of the map.
Yep.
And then do you want to come just up this path?
Yes.
And then we cross over. I think we should go, once we get there, in between the scooters, there's a path, so that we're not in the bike lane. So Marina, you can kind of come, yeah.
If you're ready?
Here? So I'll kind of signal to you to walk over when we're ready. Is this a good distance? Yeah? So tell me when you're ready, Mark. Okay. Hello, and thanks for joining this live social media broadcast from the World Health Organization. My name is Lindsay McKenzie, and I'm a communications officer with WHO. And today we're doing something a little bit different. We are joining you live here from the hospital San Orsola. We're in the city of Bologna in northern Italy. And we're here today to talk to some WHO colleagues and partners who are working on issues related to the design and structure of hospitals and other health facilities in relation to COVID-19. So later on in this broadcast, I'll be speaking to a WHO engineer and a WHO architect who are working on the COVID response with us at the World Health Organization. Before I do that, I want to tell you just a little bit about where we are and the background of this hospital. So first, to join me, I'm here with Maria Tadolini. She's a researcher at the University of Bologna, which is built in the pre-COVID era, was working on our TB program, and she continues to work with the TB program today. Thank you, Marina, for joining us.
You're welcome.
Can you start by just telling me about your position, your work?
Yes. So I'm a researcher at the University of Bologna, and I'm a specialist in infectious diseases. My main field of interest but of course in the COVID-19 era. I was also asked to support my staff in the response and the preparedness for the epidemic. So I joined the team of my colleagues, and I participated to the COVID-19 activities. We are here in the hospital. Sant'Orsola is one of the biggest hospitals in Italy, and definitely the biggest hospital in Bologna and in Emilia-Romagna region. The hospital is a historical hospital. It was firstly established in 1529, and of course now it counts a lot of different buildings and is structured in different pavilions. There are more than 30 different pavilions that have been built in different years and different periods, so they belong to different periods. And the capacity of the hospital is around 1,500 beds, and there are more than 5,000 people working in the hospital, with more than 20,000 people passing through the hospital on an average day. On a yearly basis, we count roughly 72,000 admissions. So it's a large volume of activities on a routine that had to be reorganized and restructured during the COVID-19 epidemic.
Yeah, thank you. I think we can actually just come over here and show you a map of the hospital. I think sometimes when people think about a hospital, they think it's one single building. And actually, you can see here on this map that, as you said, Marina, it's more than 31 different buildings spread out over from end to end, about 2 kilometers. So here you get a sense of just how complicated it might be when you have a hospital of this size with buildings of different ages, and all of a sudden have to work to not only have a place to treat people with COVID, but also to keep people who are coming to the hospital safe,
Yeah.
So that they can still access health services here.
Yeah, as you can see from the maps, there are many different buildings. For example, the number 5 is actually the emergency room. So it's probably one of the first pavilion that is visited from the patients when they are sick. But from pavilion number 5, patients who need admission may be transferred to many other pavilions according to their needs and according to their medical conditions. So it was not that easy actually to organize activities in such a structure, because in such a building, because of course during the COVID-19 epidemic, initially activities were centralized in the infectious diseases department, but when the number of patients exceeded the capacity of beds of the infectious diseases department, other wards had to be found to accommodate COVID-19 patients, and actually the directors of the hospital had to select which pavilions was the most appropriate to respond to the critical needs of those patients. So actually, starting from pavilion number 6, which is the infectious diseases department, they had to select beds to accommodate patients in number 5, and then they moved also to pavilion 25. So the main features that allowed the accommodation to COVID-19 patients were, of course, to have enough space to move with taking all the precautions also for the staff, to have enough space to divide the dirty and the clean path, also enough beds, of course, and enough oxygen flow for the oxygen therapy. So it was a lot of criteria have been taken into consideration to select the pavilions that could be utilized for the epidemic. And definitely one of the decision was also to allocate some wards for the suspect, so for patients who were still waiting for the confirmation from the lab, so that could not be accommodated together with the confirmed patient. So some wards were for the suspect, some wards epidemic. Actually, the bed capacity for the COVID-19 patients was more than 200, actually 235 beds for COVID-19, and 45 for suspect, and more than 70 beds in intensive care unit. So the numbers had to expand very rapidly to respond to the needs.
Thanks very much, Marina. And we'll actually come back and have Marina join us again for an opportunity for you to ask questions, if you would like, towards the end of this social media live. If you do want to ask questions, if you're following us on Twitter, you can use the hashtag AskWHO. And if you're following us on other health facilities, not just here in Bologna, but all around the world, to find ways to do that. So next I want to introduce you to my colleague Anya Borovic, who is trained as an engineer and also has a public health background. And Anya has been here in Bologna for a number of months, working with the hospital on readiness for COVID. So Anya, if you can just, first of all, thank you for joining us.
Thank you.
I know you've been very busy this week, so I appreciate taking the time to talk to our viewers about